Central Tibetan Administration's Health Department, in collaboration with Mentsekhang, has been distributing Sorig immune boosters to all the vulnerable Tibetans around the world. Since this medicine was received very well by the people, Mentsekhang has been increasing its production despite the unfavorable weather conditions. For today's conversation on Sorig immune boosters, I am joined by the Additional Secretary of Health Department, Jampa Phuntsok, and the Research Head of Mentsekhang, sangmo. Tashdile Jambala, Tashdile Rinzingla, and welcome to our show. Rinzingla, firstly, can you tell us what exactly is Sorig immune booster?
In general, Sorig immune booster is a wholesome set of prevention and therapeutic herbal formulas along with dietary and lifestyle guidelines to ensure the wholesome health care of the recipients as per directed by the physicians. But particularly Mentsekhang's immune booster is also a wholesome set of preventive package which are selected by Mentsekhang's expert and senior doctors to prevent against COVID-19. These medicines, they consist of 7 different types of medicine, including 2 precious pills for the duration of 14 days. But there is slight differences in the prophylactic package. Those who are quarantined in the abroad and in India due to some custom rules and regulations. Also there is a slight change in the duration after receiving poor compliance from the recipients. So ideal duration of the prophylactic package is for 14 days, but in the mid of July, after receiving poor compliance from the recipients, then we reduce the number of the herbal formulas as well as the duration of the medicines. And without confusing the viewers, I would like to stress that there is a clear instruction slip along with the medicine. So please take time to read the instructions, because we have also put design, diet and lifestyle as well, including wearing of rimsung ribu around your neck and using the protective arubam over your nostrils.
So Rinzingla, what is so special about this medicine that it can be consumed by the vulnerable, the frontliners, and also those people who have other medical conditions?
These medicines are specially selected to protect against the COVID-19 infection and other infections, to protect or to boost the immune system by enhancing the digestive heat, and also to balance the lung energy, which has lots to do with the mental health cares. Because people, they get stress or anxiety to hear the word of COVID-19. And not only that, also these medicines not only balance the lung energy, these also control the comorbidities like renal function, renal disorders, hypertension, and heart diseases, and also immunocompromised disease like HIV, AIDS, cancer, etc.
So Jambala, how is the rise in the recovery rate of COVID-19 patients in the Tibetan community related to the Sorig immune boosters, and how many members in the Tibetan community are currently taking this immune booster?
First initial time around March when we have organized this special task force of CTA against COVID-19, and during that time earlier it was headed by health departments, health column, and now it is headed by Mentsekhang himself directly. And initial time during March and April, everybody were very much nervous and very much tensed about the disease. It was initial time, and there was no vaccination and no any Medicare to cure this. So that's why, and we discussed thoroughly, and we all know that now immune system is very much related, because strong immunity helps to reduce the infectious risks and also the vulnerability risks of the disease. So that's why Sorig could help it. And fortunately, in the task force group, we have 2 great Tibetan doctors, Dr. Tamti and Dr. Sedan. So Dr. Tamti from Sorig medicine, and it was led by him and his colleagues that we have put together some package of Sorig medicine in order to boost the immune system. So from that way we came together to between the health department and Mentsekhang to jointly distribute the medicine freely to the people. So right now recovery rate among our Tibetan people is very good, and it's been more than now 65% of the recovery rate. But as per the Sorig medicine's direct relation to the recovery rate, it's very hard to say right now, because we haven't done that specific scientifically based statistics studies. But definitely we are confident that Sorig medicine has contributed a lot to the recovery rate, because as per general our report, what we get from the people who take these medicines is that some patients, when they are quarantined during the initial time, few days after giving them Sorig medicine, it's been reduced. So fever has been in control, and all the fever, cold has been reduced. All this we have noticed and reported also to us, because we have a special data section in our department. Right now, currently there are approximately around 90 people they are taking.
I also think that this is a really good initiative, and it is definitely producing a great contribution to decreasing the rate of COVID-19 patients. Okay, so as you have already mentioned that Sorig has been into existence in Mentsekhang for a very long time, but then can you tell us that the medicines that are there in the package, were they prepared after COVID-19 came into existence, or were they made from before itself in Mentsekhang?
Sakina, these are already existing medicines, but unlike allopathic medicine, like Tibetan medicines are formulated and prescribed under certain factors such as age, sex, and one's unique constitution, seasons and disease nature, and so on. But in the case of COVID-19 prevention, in order to avoid human-to-human communication and to maintain the social distancing, physical distancing, our expert, a group of senior doctors, they selected such medicine which are gentle in potency but fast in effective.
Okay, so Jampa, are all the members of the Tibetan community allowed to take this immune booster? Like you said that it has been prescribed for the, for the vulnerable and those who are above 65, but then like other people besides those vulnerable and the frontliners, are they also allowed to take these immune boosters? And how are these immune boosters being distributed in the Tibetan settlement in different parts of India?
Currently, we don't prescribe to all the Tibetan people. So we have specific categories, people above 65 years, and also having diabetes and also blood pressure, people having comorbidities specific like asthma and all those things, and heart disease, and all these categories we have specifically, and frontliners.
No, but are others also allowed, like if they consume this medicine, is it okay for them?
Yeah, they can take, but things that right now what we are prescribing on this Sorig immune boosting medicine is free of cost. So we are giving to those people categories, not giving free to everybody. They can take, but they have to pay by themselves. There is no harm if they take. Payment bear jointly by Mentsekhang and Health Department, and Mentsekhang bear 30% and 70% bear by Health Department CTA, and the distribution part is wholly taken responsibility directly by the Mentsekhang, the local each representative, and also the settlement officers, our Tibetan settlement officers. They have to prepare the list and also consult with the local Mentsekhang doctors, and they will provide it. If there are some local Mentsekhang's pharmacy, if there is no sufficient medicines, I have been informed by the Mentsekhang that they just sent specially by courier to the local areas wherever necessary. One or two cases were very remote, far away places, quite difficult, hard to reach. Otherwise, so far distribution has been quite well received, and almost 95% they have been receiving wherever it is necessary.
So they have to go to the Mentsekhang with the green book and then get the...
Yes. There was whoever taking the medicine freely for those categories, they have to have the green book. Yeah, chadal lagde. They have to have it.
Dr. La, how does this medicine, this Sorig immune booster, help in preventing from COVID-19, and how does it work in boosting one's immune system?
As per Tibetan medicine, immunity is the final byproduct of the nutrients which we derive from the food and drinks we regularly consume. So in order to achieve the proper assimilation of the bodily tissues and mindset, I would say mental attitude, it is very important to give great importance on the digestive heat and to enhance the digestive heat and to boost the mental health. Also at the same time to prevent the patient or prevent the individual from the infectious disorders like COVID-19, which primarily attack the respiratory organs. It is utmost important to safeguard the respiratory organs too. And not only that, it is very important to control the comorbidities and, as I stated before, to balance the lung energy, like thereby then we can calm the mind and reduce the anxiety, doubt and all. So therefore these medicines are selected along with the prescribed diet and lifestyle, not only to boost the immunity by enhancing the digestive heat and strengthening the respiratory organs, but also to ensure the holistic health care to the recipient without any major adverse effect.
Jampa, is there any kind of advice or message that you would like to convey to our viewers regarding Sorig immune boosters?
I have 3 points to appeal to the public, our Tibetan communities. Right now, wherever our people are residing, the lockdown and also the restrictions has been now reduced and it's been relieved. But we should not feel in our mind that COVID-19 risk has been reduced, because it is COVID-19, coronavirus is still very much there. So the risk is the same. Only the risk, due to economic reasons, the lockdown and the restrictions has been relieved. So we have to always keep in mind that if you love yourself, if you love your families, we must always take care of the coronavirus. It can strike anytime, anywhere. So this is my appeal, that please remain alert all the time. Take all the required precautions. Whatever we are distributing freely is out due to our love and care for our people. It's not that when we get those packages, medicine for immune boosting, if they have taken the medicine, you have to complete all the medicine, never leave it somewhere or throw it away. I appeal to the people that this medicine package is designed by our expert doctors, Sorig medicine doctors. So respect to this and respect to the CTA's effort to combat the COVID-19. Sorig medicine, what we are giving is for immune boosting only. So in that way, it can help us to combat strongly against coronavirus if that happens to us. Always keep in mind that Sorig medicine is not the direct prevention of the coronavirus. Any people who are infected or who are afraid of the coronavirus getting contacted to them, so they have to think in mind that it is obvious that we have to take whatever the allopathic medicine, whatever there is a service help by the local or the Indian government or the Nepal government, wherever we get all the support allopathic medicine. With that, it can also help us if we support those medicine by the Sorig medicine. But it is not necessary that you have to take it. It is your willingness you have to look after. Then if you are willing to eat, you can take it, and it definitely it helps, and at least it won't harm. But don't think that Sorig medicine immune booster itself will cure.
Thank you, Jampa, for emphasizing on all these important measures and letting our viewers know what is important regarding Sorig. And thank you, Dr. Rigzin, for letting us know more about the medicine. And thank you to Mentsekhang and also to the Health Department for taking this wonderful initiative. Thank you for coming to our show.
Thank you.
Thank you so much for watching, and see you in the next episode of In Conversation with Tibettv.